After fighting COVID-19 for a full year, this is the news that no one wants to hear. The Ontario Hospital Association says we're now in a third wave.
But Farah, just like pretty much everything with COVID-19, opinions differ on whether or not that is actually the case right now. Matthew Bingley is live at Toronto City Hall tonight, where the city's top doctor has detailed concerning trends. Matt.
That's right, Alan. Well, the race is on to get vaccines into arms, but cases, including here, are on their way up. And that answer to whether we're already in a third wave really depends on who you ask today.
The COVID-19 variants are triggering third waves in Europe. Several countries are imposing new lockdowns or restrictions.
Toronto's medical officer of health issuing a stark reminder of how quickly progress can be lost. Several countries are in the midst of a third wave, and the Ontario Hospital Association says you can add the province to that list. In a tweet, it says, with the new VOC cases steeply rising and ICU numbers trending up, nearly 350 today, strong adherence to public health measures is urgently needed to prevent overwhelming hospitals. Tracking COVID-19 in the province and Toronto shows it's nowhere close to the second wave's spike, but it is once again on the rise.
Toronto's 7-day moving average for new COVID-19 cases is now sitting at 420, up from 354 on the 9th of March.
Dr. Eileen Davila says Toronto's latest trends aren't looking good. The data matching what provincial modeling revealed last week of stalled progress fighting the virus, driven in part by highly contagious variants and increased mobility. Anonymous data gathered by TPH backs that up, with people not staying home as much as they were.
It's thousands of people, we can see it from the phone data, going literally to shopping malls that were open. Now the ones that are more open in Toronto, yes, there's that. But every day you just look at the traffic cams on the Gardiner, the Parkway, the 400, people pouring in it.
But do our top public health doctors agree the third wave is upon us?
To my mind, it's still early to say. Certainly this is not the direction that we want to see the numbers go in.
We're in this dip and coming up. Is it a slight undulation? Is it a large wave? Is it a moderate wave? To be determined.
Matt, Toronto entered the provincial gray zone a week ago. Any word on when there might be a recommendation on where the city goes on that color-coded framework?
Well, Alan, Dr. Davila told us that we would hear a decision on that by the end of the week. Both she and Mayor Tory were both talking about the number of discussions that are ongoing, ones they say which will likely ramp up between them and the province, rather, as the week goes on. Now, there are a number of considerations to take in. Among them, public health, they say, is the highest one, but also business and mental health, along with regional factors that play into this. But it is worth noting they say this every time we come up to a decision like this, so we'll just have to stay tuned.